Officials at the Centers for Disease Control say they don't want a repeat of last year's high flu numbers. An estimated 700,000 people were hospitalized. 180 children died in 2017. So they're urging people to get the flu vaccine now, the vaccination. And Touro's family medicine physician, Dr. Meredith Maxwell, is here to discuss the importance of this. So, good morning, first of all. Good morning. Get it back, get that right now.
Yes, right now, because it takes about 2 weeks for the antibodies to develop in your system. So for it to become effective and protect you, it takes a little while. And October is the start. So you don't want to get that flu if you can help it.
So, you know, you'll hear people. Let's just talk about the elephant in the room.
Yeah.
I don't get the flu shot because it'll give you the flu. What about that?
That is very false. There are a couple reasons why you could get the flu. You could have been exposed, or flu-like symptoms. You could have been exposed to like a rhinovirus or a cold symptom, and you might mistake that for the flu. You might have been exposed to the flu like before you got the vaccination, or we could have guessed a little bit wrong with what flu strains are coming down the pipe at us.
Okay, so you've mentioned this in the past, and we were talking outside in the hallway a little while ago. Something that people don't understand is that even if they miss a little bit, and they do sometimes on what kind of flu shot they should have, there are still benefits to getting a flu shot.
Correct. So even if we guess wrong about the strains that are in the vaccination, if you get the vaccination, it can decrease your severity and length of time of the flu symptoms that you do get. So you still do get those benefits. It's just not complete protection.
And then the idea that, you know, you're not just looking, from a public health standpoint, you're not just looking out for yourself, something that we forget about sometimes when it comes to things that you can catch.
Exactly. They're like, I don't care if I get the flu. Well, what about the elderly woman in front of you in the grocery store line who has COPD, who if she gets the flu could be hospitalized, or the baby behind you that's less than 6 months that can't get the flu shot? So it's about protecting those that are very, you know, susceptible to this virus, not just yourself.
And I guess that's a part of it we don't understand or think about sometimes, which makes, you know, that's understandable, but there is, with an infectious disease, there is a sort of a collective sort of good here at work.
Correct. It's a domino effect, and that's why it can get so out of control.
When do you know you have it?
So you can get symptoms like 1 day before you actually feel anything, and then up to 5 days they consider you, you know, contagious after you get the symptoms.
All right. So if I get this, what do I do?
So stay home for 24 hours until you don't have fever without like Tylenol or ibuprofen. And then definitely prevention, hand washing, cough into your elbow. You know, if you're sick, you know, really stay home because you could give it to everyone.
All right, put yourself in a bubble. Got it. Dr. Meredith Maxwell, thanks as always.
You're welcome.
7:20 now. Let's go to Shelby Latino.